spine is protecting the nervous system.
Okay.
The nervous system is made up of the brain, the spinal cord, which runs through the spine, and these different peripheral nerves that exit out of the spine that go to every muscle, organ, tissue, and gland. The way the body remains healthy is through proper communication with the brain. So if there's a problem with the heart is sending communication systems through the nervous system up to the brain. The brain makes the appropriate diagnosis, sends out the appropriate healing response out back through those nerves back to the heart, and the heart remains healthy. It's when there's improper communication between the nervous system, the organ, the nervous system, and the brain that we begin to see what most chiropractors like to call dis-ease, a dis-ease process. The body is no longer healthy, but it's not in a state of dis-ease. But if that goes on long enough, it can create major health problems and what many doctors call disease processes.
It's a lot bigger than just treating back pain, okay? Your nerve system basically controls and innervates all the cells, tissues, and organs in your body. So similar to dentistry, you brush and floss your teeth because you want to maintain them, you want to prevent tooth decay. Same thing, chiropractors take their hands, they put motion into the spine to restore function and motion, and that spinal integrity, okay, will help his spine last a long time. In the event that people don't take care of their spine, your spine has a tendency to degenerate and get something called osteoarthritis. When that happens, you start affecting the nerve roots. When those nerves that control your organs start to get pinched or damaged, you start to have ill health and disease builds in your body. So having regular adjustments to the spine will help your spine stay healthy.
Because we always go back to the central theme is that the nervous system controls and regulates the body. The spine protects that nervous system. Muscles and ligaments are attached to the spine, so there are three ways that the bones in the upper cervical region can become misaligned and irritate the nervous system. One is through accidents and injuries, and most people can understand this because if they fall on their rear, they bang their head, they can see how there's a jarring that takes place in the spinal column that can dislodge that spine and misalign it. But what most people don't understand is that emotional stress and chemical stress can affect the spine the same way. You brought up the point that we mentioned that muscles attach to the spine. So when there are muscles attached to the spine and someone is under tremendous stress, chronic stress, constant stress, what does stress do to a person's muscles?
It makes them tight to spot.
Makes them tighten up.
Right.
And so on a small level, if those muscles are continuously tightened up, there's going to be rigidity up in this upper cervical region. Going on long enough, it will actually cause this bone to displace because there is abnormal stress on those muscles. That will cause it to misalign. That will cause irritation on the nervous system and starting the whole process all over again. Same thing happens with irritants, chemical irritants. The nervous system functions both electrically and biochemically. So chemicals will have an adverse reaction on the nervous system as well. Overloaded chemicals, too much chemical toxins will irritate the nervous system function, irritate the flow of the transmission of the nerve cells, which will then begin to irritate the muscle cells. The muscles will then begin to contract again, causing the spine to misalign.
Well, the obvious reasons are that if you suffer from back pain, scoliosis, or tight back muscles, then this is going to help relieve the pain, soften those muscles, and relax your spine. The not so obvious reason comes from the fact that your brain and spinal cord affect your entire body. They affect your muscles, it affects your digestive system, it affects the hormones of your whole body, and the blood flow. So when you give yourself this spinal massage, it's going to open up the spine and allow the spinal nerves to come out and nourish your entire body. If you have any chronic diseases and you want to be healing from those diseases, then you've got to look at your spine and do something that's going to help your spinal health on a daily basis. Even high blood pressure, diabetes, or hypothyroidism. So let's get started. Now, what you don't want to hit is right in the center. If you touch your own spine or someone else's, you'll feel some bones right in the middle. Those are the spinous processes, and if you hit on top of those, it's just going to hurt. So you don't want to do that. The other place you don't want to hit is the medial edge of the scapula. So the scapula is this triangular bone, the shoulder blade bones here, okay? And so the medial edge is this bony edge right here, and you can feel it on someone if you're there. The way to avoid that is by feeling the spine and focusing your massage right next to the spine. If you stay right next to the spine, then you won't hit the edge of the scapula and you won't cause yourself pain.
A spinal flush works the reflex points up and down the spine, improving circulation and stimulating the immune system. In fact, this is the most effective way that I know of to create an immediate, significant result. And we're going to perform a spinal flush to help keep his system in peak condition. I'm using lavender essential oil for its aromatherapeutic properties. Never press directly upon the spine. You can see that my fingertips are on both sides of the spine. Just for demonstration, I'm going to do a 1, 2, 3 count as I move my way down the spine, starting at the neck and working my way down to the tailbone. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. When I reach the base of the spine, I work my way out to the hips. Now watch as I create flow. This is a very important step in the process because it uses natural energy to release toxins and to stimulate the flow of spinal fluids. I will demonstrate again. Watch as I create flow. When I reach the hip area, I allow the energies to move from the spine to the hip, down the leg, and to release at the ankle, giving a pinch at the ankle pressure point to initiate release. Then I do this on the other side, which is always necessary for balance. This process is so simple and can be done in just minutes a day, and you can achieve great results.
Sometimes, let's say you are in any kind of relationship. You have a close coworker, a friend. More importantly, if you are in a romantic relationship, and you're feeling really cranky and you're having a problem communicating, what you want to say is, okay, up against the wall. And then let me show you how that's done. So Tony, get up against the wall.
Like this, yes.
Yes. Now, again, you come up, you find the spine, and you come an inch out, and you just knead in here as hard as you can, going down their back. Put your full body weight into it. And again, you might go a little bit slower than I'm going right now. And you do it 2 times, which I'm not going to do right now for the sake of the video. And then you again sweep off all the energy. Sweep off any of that energetic clutter that maybe came to the surface that you don't need.